submit their first draft of how they plan to distribute a COVID vaccine when it becomes available. Now, they had just 30 days to pull those plans together as the medical community races to try and create an effective vaccine.
But of course, all the coronavirus planning is happening while doctors are working to get people this year's flu vaccines, hoping to avoid what scientists are calling a twindemic this cold and flu season. Dr. Ann Thomas, a physician with the Oregon Health Authority, joins us live this morning to talk all things COVID and the flu. Good morning, Dr. Thomas.
Good morning.
So let's talk about the so-called twindemic. I mean, doctors are worried about seeing that simultaneous rise in both COVID and flu cases. What would the effect on the healthcare system be this winter? Are Oregon hospitals ready for this?
Well, we're doing our best. What happens is that, last spring when we first started seeing COVID cases, we were also seeing simultaneous influenza cases, although after about the first month, their numbers went down. But typically around this time or perhaps later, I mean, flu is very inconsistent from year to year. We see numbers going up. And there have been times in the Portland metro area, for instance, and in some other counties where, there are enough influenza hospitalizations that, the supply of hospital beds does become critical. So that's where we're certainly concerned about that.
Yeah, well, I mean, and we all know, of course, there is the flu vaccine, which is probably
Right.
the best way to protect yourself. But are there any other ways that people can protect themselves from the flu?
Sure. Well, the good thing is that all the things that we're already doing to prevent COVID also prevent flu. Every year I do interviews like this and people ask what they can do to prevent the flu. And of course, the number one thing is to get the vaccine, but also there's good hand washing, there's covering your cough and staying home when you're sick. And I always lament the fact that, gosh, people just don't stay home when they're sick. And I think now that's much more ingrained in us. And so I'm actually hopeful that these habits will actually prevent a bad flu season.
Yeah, I think the stay home message is certainly being reinforced a little more strongly this year. So I'm curious, how long does the flu shot take to become fully effective once you get it?
2 weeks. And at this point, we've started our weekly flu surveillance reporting. So you can go online and look at, you can Google flu bites Oregon and find out everything you need to know about flu in Oregon. But at this point, although there has been some testing done in the state, we haven't seen many positive results. So far, so good.
So now would be the time that you would want to be getting that vaccine to give it time to really reach its full efficacy before we see those numbers going up?
Exactly. In fact, I have my own appointment in a few hours to go get one.
Yeah, they've made it so easy this year.
I know,
was at
see, we both got ours.
I was at my OB's office and they offered to give me one there. That's never happened before.
Yeah.
I thought, well, sure, I guess I'll get one since I'm here.
here.
Yeah, no, it's so available. So is it possible, I think some people are worried about this, for someone to contract both the flu and COVID-19 at the same time?
It is possible. Certainly last spring, we saw people that had both infections. At this point, we don't know enough about that, whether it's going to make it a worse case or what's the best way to treat it. I mean, there is a medication, there are antiviral medications that are effective for influenza, and certainly anyone who's sick enough to be hospitalized with flu would be started on, Tamiflu. And so it's important to, what we're going to see is that a lot of laboratories will be testing people for both flu and COVID, so we'll know exactly what we're dealing with.
Dr. Thomas, I think one of the barriers to getting the flu vaccine out this year is the fact that many employees are now working remotely or working from home. So for people out there, if you always had a flu shot day at your office every fall and that's not happening this year as we socially distance, what are some of the best ways and easiest ways people can go and get the vaccine this year?
Sure. Well, you can always call 211 and find, like, locally where you can get a flu vaccine. The best bet too also is to just call your provider and see if they can offer it. Lastly, I mean, retail pharmacies. I've often gotten mine at my local pharmacy.
Yeah, it's real easy to get in there as opposed to like my kid's doctor, you know, their doctor, because it's so backed up. So thank you so much, Dr. Thomas from the Oregon Health Authority, for giving us this valuable information. A lot of people paying attention to this topic right now. Have a good morning.
Thank you, you too.